Hi, I'm Helen Souris. I'm the CEO and Executive Director of Cardihab. It is a digital health company that spun out of CSIRO 10 years ago. I'm also a board member with the MTAA, and I chair the MTAA's Digital Health Advisory Group. The current gap for cardiac rehabilitation in Australia is that about 80% of people who should get access to rehab miss out. And that's because conventional models of care are largely driven by face-to-face models. People have to travel and commute to go to a clinic. So 20% of people get access to care after a heart surgery, and this includes coronary artery bypass surgery, major procedures. They're not getting access to cardiac rehabilitation. A data linkage study in South Australia, which followed 5 years of patients across all aspects of the health system, found that only 10% of people in South Australia got access to rehab. So these are significantly deficient gaps in care, and it's even worse when you get to regional and rural communities. So most people in Australia are missing out on something that is proven to deliver life-saving benefits, proven to reduce hospital bed days, proven to improve quality of life, and proven to improve the management of cardiovascular disease, which is Australia's leading cause of death and the leading cost to the healthcare system. Cardihab is a digital health company that develops digital therapeutics. Digital therapeutics are programs where there is a care plan, an app for a patient, a systematic approach to delivering care that's delivered through software as a medical device. Cardihab's product is registered with a TGA as a Class 2A medical device, as should all digital therapeutics or digital app-based programs to deliver care management of serious conditions like cardiovascular disease. When we first started our journey with Cardihab 10 years ago, we spun out of the CSIRO, and that was a concept that was initially delivered on a smart technology, a Nokia phone, and that phone technology was then adapted to smartphone technology as we know it today.
I was offered the rehab program to do at home because it was going to make it hard for me to drive up and down to Townsville 3 times or twice a week.
That program guides them through a 6-week program of recovery. They've also got direct contact with a healthcare professional, a clinician or a nurse that actually talks them through their recovery journey so that they can actually get back to good health after they've had their event, and they can do it from home. They don't need to leave and travel vast distances to be accessing the clinical support that they need.
She'll turn up on your phone and just guide you exactly on what to do. Yeah, it's really great. And there was other people involved as well in other towns. You get to know the other people and what they're experiencing and how they're going. And
when we first started our journey 10 years ago with Cardihab, the question we were asking the marketplace was, why should you use a digital alternative to cardiac rehab? That today, 10 years on, has changed fundamentally into why aren't you using Cardihab? Over those years, we've built a full, robust body of evidence from a randomised controlled trial from the CSIRO through to a number of real-world studies, of which 3 publications came out last year. Those independent publications from the Baker demonstrated that we improve survival, we improve quality of life years by 1.4, we do that cost effectively, and in a health economics evaluation which won an award for the author, we demonstrated that in 87% of scenarios, Cardihab delivers more cost-effective care than the alternatives. So we have fantastic evidence behind our program that demonstrates we make a material and important difference to quality of life, access to care, completion of cardiac rehabilitation. So we've now taken the posture of why aren't you using Cardihab forward. And the 85% of health funds that have seen the value in our program are working closely with us to improve access through the private health sector. We also have a statewide contract with the Tasmanian Health Service, where all hospitals and all participants that are eligible for rehab have access to our model of care as well. And they are exemplars of leadership and embracing digital technologies to solve what is today an unsolvable problem with conventional models of care. So our journey has really been fueled by those visionaries who've seen digital as an answer to help fill those critical access to care gaps and have worked with us tirelessly over the last 7 years to really start to get an impact on access to care. Today, The biggest issue we have is all of the health services in the public sector that we go to, that we speak with, that want our product, who constantly say to us, we would love to take it on board, but there's no funding. There's no budget for the technology, and therefore we can't take it on. And I think that is the absolute issue that we are working so tirelessly on now, is to fix that inequity, where private health insured patients get access to our world-class technology and the public sector is missing out.
Having experienced the world of startup for 10 years now with Cardihab, I know very well the pain of going into a room and having to pitch to someone about heart disease, and everyone knows what a heart is, right? But there are some horror stories I learnt as I was talking.
One of the catalytic moments for Cardihab when we first started our journey was about 7 years ago. I joined the organisation as CEO, and we made determined steps to build solid quality management systems that will enable us to be registered with the TGA. That was way ahead of the regulatory authorities changing the rules around digital therapeutics. So we embarked on getting our Class 1 registration about 5 years ago. And that was a really important step forward because we knew regulation was coming for these sorts of products that can have meaningful impact. We were the first in Australia to have that registration, and this is a really important element where these sorts of products globally are requiring regulatory clearance now to be used. So for us, it was about leaning in with evidence, making sure that we had the robust quality management systems and frameworks in place to meet the expectations of our customers and to meet the expectations of our patients to keep them safe. So that important step has led us to the point now where upregulation from the TGA in 2024, our product is now a Class 2A registered product. And this is the direction that we saw coming, and we're making sure that we had adequate preparations and everything in place to comply with the requirements. This is a category of healthcare which is globally required. In Australia, we have vast distances where people live in communities hundreds of kilometres away from metropolitan-based services. And our program can reach those people without need for transport, without need for flights, without need for any commute. So our product reaches people where they live, and that's critically important for the vast territory in Australia, but equally important in other markets where communities live in regional rural areas that just do not have access to the resources that are available to their metropolitan counterparts. So our product has absolute value in Australia, but it also has an important role it can play in the US, in Canada, in the UK, any market where people are dispersed in communities where they don't otherwise have access to resources and healthcare services. The Productivity Commissioner did a review of digital therapeutics in Australia a few years ago and found that there was only 31 registered products on the TGA that were digital therapeutics. And it shows that this sector is still in its infancy. But if you fast track to 2030, this will be a common and mainstream way of supporting patients with chronic diseases that have both acute episodes in care in hospital, but also live with those conditions in community. So diabetes, hypertension, cardiovascular disease, respiratory diseases that are chronic. These are all absolutely valid applications of technologies that are similar to ours. And that's where we see the future of digital health, is through those integrated technologies that bring wearable data in a clinical conversation, that have clinical oversight, not self-help, that really make sure patients are getting a holistic, managed program of care, supported and enabled through digital technologies like digital therapeutics.
Because it's the curiosity that makes you question what's in front of you. It leads you to be an advocate for yourself, your friends, your family. And if you are curious and you follow it all the way through, you actually get to a point where you find the action that will deliver the change we need. And if you're not curious and you don't act on your curiosity, nothing will change, and it will take 20 years. So please be curious, act on your knowledge, put it to good use, and inspire those around you to do the same, because I'm really excited about where we are with women's health today, and I know we can all do it together. Thank you.
The government's vision through the 2030 blueprint, the 10-year blueprint, is spot on. What we need, though, are the mechanisms to enable us to deliver it. We have the tools and technologies today. We don't need to build anything new. We just need to procure it, we need to fund it, and we need to make sure that all of the startups like us who have worked tirelessly on building technologies with clinical evidence, validation, are actually funded to deliver that care in the health system today. For too long in Australia, we've relied on grants, on special access programs where there's a budget for innovation or a philanthropic pocket of money that we can access to trial and pilot these technologies. And time again, we prove that these technologies make a meaningful difference. They improve survival. They improve quality of life. They reduce hospital bed days. These are the things that these technologies can deliver, but they're only delivering it in spurts and patches because it's a piloted funding. So if we really want to have an impact on the hospital bed day cramming, if we really want to have an impact on quality of life, if we really want to have an impact on the issue of clinical staff shortages, we need to fund these technologies that enable clinicians to deliver care more efficiently, with less burnout, with greater reach, all of the things that we want to have a healthy and thriving health service. These are the things that we need from government. The funding for digital therapeutics, for remote patient monitoring, for digital health solutions that have gone through the pathway of rigour, that have gone through the evidence journey and registered with the TGA, is a critically important pivot now for the health system to embrace. And they can only do that with the right level of funding and reimbursement.